Hi, I'm Laura Peck, a principal scientist at Abt Associates and global lead for Apt's Research Monitoring and Evaluation Capability Center. Today, I am answering some questions about evaluation research and the coronavirus pandemic. This is an important topic because outside influences like the economy and major health, social, and environmental events tend to create problems for program evaluation. The health, educational, social, and economic consequences of the coronavirus are huge, but our evaluations go on. How are we supposed to figure out whether it's our programs as opposed to the rest of the world that's the reason why we might see change in program outcomes? This is a question I received from a graduate student at Claremont. We have been implementing an evaluation from the beginning of the program and have completed the second year data collection. Then COVID-19 happened. We had to postpone the final year's data collection. Can we come back and do the data collection at some point? Will the data be comparable to the first and second year's data? What strategies can we use to cope with this threat to internal validity? Even if we revise the data collection instruments to identify the effects of the interfering event, can we still compare the data from different time series or comparison groups? Okay, first, for those of you not familiar with the term, let me define threat to internal validity. That refers to something that is not the program that might be the reason for an observed change in outcomes. So a major health crisis could be the reason that there are changes in outcomes, and that is a threat to the internal validity of your evaluation. So in terms of the comparability of data collection, under the circumstances, you would definitely expect that the final year's data would be meaningfully different because of the pandemic from the first and second year's data. If you have a pretest, posttest design, this is a real problem. If you have an evaluation design that has a randomized control group, it's less of a problem because both the program and control group experience the same conditions. If you have a non-randomized comparison group, then in theory, it may or may not be a problem, but in practicality, it probably is. So without a control group, I would recommend that you work with your partners to think about how the pandemic might be affecting the outcomes of your program participants. Then use that thinking to revise your instruments and try and capture what the pandemic is influencing as separate from what your program is influencing. It will help to have a clearly articulated logic model, or even better, a fully explicit theory of change. So for you or anyone else with a specific problem, I would be happy to follow up to learn more and provide some more concrete advice. Okay, moving on to the second question. Thomas Sebastian from the University of Michigan School of Nursing asked, in broad strokes, who are you partnering with to evaluate COVID-19 responses, and what questions might you ask? So I work in Abt Social and Economic Policy Division, and in my part of the company, we're trying to figure out what the pandemic means for the programs that we are evaluating. And elsewhere in the company, my colleagues in the Division of Health and Environment are more directly assessing frontline responses. So there, in our work with the Centers for Disease Control, the CDC, we're working with them and our clinical partners around the country on a set of cohort studies with various populations of interest to ascertain the key epidemiological parameters around transmission, rates of illness and infection, and clinical and behavioral risk factors. So those studies are leveraging existing infrastructure and tools from our long-established CDC influenza pandemic preparedness portfolio. And as such, they are mounting a rapid response to try and understand what's happening on the front lines. So these are just a couple of examples of our research partners and the topics that we're engaging around. Finally, the third question I got was, what resources do you suggest evaluators consult when thinking about the impact of COVID-19 on local program evaluation? Okay, well, the good news here is that there are lots of resources out there, and you are not alone. For a general overview of how to think about the interaction of the pandemic with public policy research, I will shamelessly self-promote and suggest that you read a paper that I wrote together with some smart colleagues. It discusses study design, data collection, and analysis considerations, and you can find it at tinyurl.com/PPR in a pandemic. That is public policy research in a pandemic. For more general resources on evaluation, you can access the American Evaluation Association, eval.org website, where there are lots of links to resources, including online handbooks and texts, local affiliates, and group forums where you can engage, connect, and learn. The Centers for Disease Control also has program evaluation resources available, which you can find online via its Office of Program Performance and Evaluation. And we have all of the links to those resources, plus several more associated with this recording. And so please search there and click through. If you have a more specific ask, then please do reach out to me via Twitter at @LRPeck or LinkedIn. And there we go. That's all we have time for today. And I want to thank you for participating, for submitting your questions, and then tuning in now to hear the answers. So feel free to keep more questions coming at #AskAbt on Twitter. And so this finally is how Stephen Levitt of the Freakonomics podcast has been closing out lately. Please take care of yourself and someone else if you can.